Is that Ahmed, who's a bariatric surgeon at Imperial College NHS Trust, has joined us in the studio, and I'm grateful to you. I'm sure people would really welcome the idea that there's a big reduction in the number of people with type 2 diabetes. But should NHS resources be spent on doing this when, if people just went on a diet, you wouldn't need to?
Well, the problem is that diet and lifestyle changes in the morbidly obese population actually do not have an effect on treating their health problems. When you reach a state of severe obesity, numerous studies have shown that weight loss surgery is the only effective means of providing long-term sustained weight loss and therefore improvement in health.
Why? Why if people get grossly obese, can they not deal with the problem?
It just does not work. It's easy to diet, absolutely. Everybody can diet, but the weight loss is only short-term. And as soon as you stop dieting, you regain the weight, and hence your problems return. It's like asking you, for example, to hold your breath for 10 seconds. You can do it, but can you hold your breath for 10 minutes?
But seeing as it is a condition that has been imposed, I'm just interested in the sort of the science of it, if you like. I mean, I can understand that psychologically people might find it difficult to keep on, but if you know, there's no great mystery to dieting. If you eat less and exercise more, you will lose weight.
Yes, that is true, and that works for moderately overweight people. But when you reach a stage of obesity, and remember, we're talking about people with a body mass index over 40, so this is, on average above 15, 20 stone in weight. It is next to impossible to get weight loss from dieting, which is going to be maintained. It's this problem with dieting is that the effects are only temporary.
So if you have this surgery, what does it actually do?
Well, it depends on the kind of operation we do. There are many different kinds, but in general terms, what we do is we change the shape of the stomach, make it smaller, and that in turn reduces the amount of calories that can be taken in. At the same time, various hormonal changes are happening as well from the surgery, which actually alters your hunger levels and also your fullness levels after you eat food.
I hate to draw a sort of parallel with banks, which seems a really odd thing to do, but the kind of whole issue of moral hazard. If you think, I can just eat and eat and eat, and frankly, then I'll just get some surgery and it will get sorted out, then you don't take any moral responsibility yourself. I just wonder whether you think there is an ethical, moral issue there.
No, I don't think so, to be honest with you. I think patients who suffer from obesity, it's actually a disease. It's like, you could say it's like cancer or heart disease, and it should be treated in equal terms. And the best thing, of course, with treating obesity is that by treating one thing, you actually improve a myriad of other conditions, diabetes just being another one of them.
And I suppose, in brief then, it means that it's a very cost-effective operation, because, frankly, you're saving the NHS money on a whole pile of other things.
Indeed, and that's been shown in this report. The direct cost of treating health-related problems from obesity is about £5 billion a year to the NHS. Just to give you an example, the treatment cost of diabetes are £3,000 a year per patient. A gastric bypass costs the NHS £10,000, and it's a one-off treatment. If you pay £3,000 a year per diabetic, you can imagine, that's going to cost 15, 20, 35 years of treatment. So you can see the results clearly.
Fantastic. Okay, very interesting to talk to you. Thanks so much for coming into the studio. Thank you.
Thank you.